Well, welcome to today's Cardiac College online session. Today is Monday, March the 1st, and we will be presenting about heart rhythms. But here you'll see that there are a number of sessions coming up this month, in addition to all of the great programming that happens in the context of your cardiovascular rehab classes. There's sessions that are happening pretty much every week about heart medications, how the heart works, nutrition topics, diabetes topics. So we're glad that you are taking the time to join us, either live or perhaps you're joining in after the fact and watching the recorded sessions on the Cardiac College online web platform. All of these are available for recording later on, and you'll find them in the live events calendar 1 or 2 days after the session. As mentioned, today's topic is being brought to you by popular demand, and we're talking about the rhythm of your heart, fast, slow, and irregular heartbeats. My name is Paul O. I'm the medical director in the program. It's my pleasure to spend time again with you through this series, and I do hope to get to see you live during some of our classes at some point. A reminder that these sessions are provided for your education. If you have a very specific question about your own health situation, we'd ask you to connect in with your own healthcare provider. Do you need a change in medications or an approach to therapy? These would be good things that your doctors would be very pleased to hear about. We do want you to ask questions, though, through this. And in this Zoom platform, you'll see either at the bottom or top of your screen a little box that indicates Q&A. If you'll type in questions as they occur to you throughout the session, we'll spend a few minutes at the end of the formal slide deck to look at those questions and address them. Your questions are actually quite important so that we have a sense of what's important and on your mind. Okay, we'll start this by some grounding, some framing in normal anatomy and physiology. And this harkens back to the session called How Does Your Heart Work? If you heard it before, it's a recall. If you haven't heard it yet, it's coming up in the next couple of weeks. But to remind us that the heart is an organ that's about the size of your fist. It lies in the center to left part of your chest. It is surrounded by the lungs that are almost like a pillow to cushion it. And of course, the lungs pick up oxygen that is delivered to the heart, and then the heart pushes that all around the body. The heart has a structure composed of 4 different chambers. In the upper parts are 2 atriums or atria, and then in the bottom are 2 ventricles. And these connect into large blood vessel systems that initially push blood out from the right side into the lungs, return it back to the left side of the heart, and that pushes out through the body. There are 4 major systems within the heart. The plumbing system provides oxygen-rich blood to the heart muscles so that it can do its job of contracting. It is governed also by an electrical system. Think of it like wiring in your house that tells the heart to beat in a very synchronous fashion with the electrical signals starting from the upper part of the heart to the lower part of the heart, and allows it to beat in a regular fashion. We'll talk more about that. There are valves that separate out the different chambers of the heart. And then the walls of the house are like the muscle that makes up the walls of the ventricle to allow for pumping to happen. So these 4 systems need to work in harmony. They all need to be intact for excellent functioning of the heart. When things go awry, then we have different manifestations of so-called heart disease. And when there are problems with, in particular, the electrical system of the heart, that's when we may develop problems that are called arrhythmias. If you know your Latin roots, so rhythm is in the middle, so that's the normal cadence or the beating of the heart. When that's in front of any medical word, that means that things have gone bad. So there's a bad rhythm problem of the heart, and we might lump these under electrical forms of heart disease. In the normal anatomy physiology, we also talk about the electrical systems of the heart. And normally, electrical impulses will arise in the upper right side of the heart, and high up in the right atrium, there is a junction box called the sinoatrial node. Think of this as the body's internal pacemaker, and this drives electrical signals down these major cables of the heart. It passes through another junction box separating the right atrium and the right ventricle, and travels down these major electrical bundles. When everything's working well, there is regular conductance of electricity. The heart beats in a normal, regular way. But as the heart electrical system ages, problems can arise. And the analogy that we use is that if you've been living in a house for 50 or 60 or 70 years, think about what might go wrong with the electrical systems after 50 or 60 or 70 years. What does the junction box look like? Are the fuses worn out? Indeed, do you still have fuses in your electrical box? That might be a little bit old in terms of technology. Think about the wires that go through the house. Are they modern copper wiring or something else? Or are they older knob and tube kinds of things? Have you had mice and rats get into your walls that may start to chew the wiring? Has the insulation worn out, etc.? So there are problems that can happen with electrical wiring, and it's not surprising after decades of use that these things may wear out to some degree. So let's talk about the irregular kinds of heartbeats that are common. It is not uncommon at all to have beats that are slow or fast. Types of rhythm problems where there may be blockages in the transmission of electricity from the top to the bottom. There may be irregularities that come very fast, and atrial fibrillation is one of these examples that is quite common in our populations. And there may be irregularity either as single beats or multiple beats that can be of even more importance. And we're going to walk through these in detail, and I'll show you examples of what those electrocardiogram signals might look like when you see your doctor and get one of these heart tracings. What are we in fact looking for? So let's start with the usual heart rate and rhythm. Typically, the heart rate, the pace of it will go from 60 to 100 beats per minute at rest. And for most of us online right now, it'll probably be 60 or 70, or maybe even a little bit slower because of the medicines we might be on. As long as it is within this range and is nice and regular, we'll call that, quote, normal, or normal sinus rhythm. And the sinus refers to the sinus node way up here that is the typical pacemaker of the heart. And this is the electrocardiogram from a normal heart tracing. Think of the electrocardiogram as a bunch of camera angles on electrical signals. Imagine if we could position 12 different cameras on your chest and watch the electrical beats as they move along. If I start at the bottom here, this is called the rhythm strip that is typical on electrocardiogram. And then each of these Roman numerals and letter symbols denotes a different camera angle. 1, 2, and 3 are different pictures from the front of the heart and from our arm angles. V1, 2, 3, 4, 5, and 6 denote different stickers that go across the front of our chest. So they're kind of doing a rotation across the front part of the heart. And then these ones look at signals from the right side, left side, and from the bottom upwards. So 12 different camera shots on an electrical signal from the heart. Usually the heart electrical activity looks kind of like this when it's normal. And you'll see here that it starts with a little small beat, a sharper spike, and then a medium-sized spike. In nomenclature that started in Germany about 100 years ago, folks started naming these sorts of waves. And the first one was called the P wave, for instance. Instead of going A, B, C, D, E, F, they started with P. And P denotes that there is an electrical impulse in the upper part of the heart signal in the atrium. And P, when this electrical signal goes, the upper chamber of the atrium squeezes. And then there is a sharper, larger electrical spike called a Q, R, and an S that signals to the ventricle that it's your turn to beat. And then T, we think of as reset of the whole system before the whole beat gets triggered once again. So P, Q, R, S, and a T. And we can look for abnormalities in any one of these waveforms that gives us a clue that something might be going on within the heart. We're going to focus on irregularities in the pattern and the speed of these signals today. And at another point, we may be talking about irregularities in the shape of these waves, which would give us a clue about what might be going on vis-a-vis, say, heart attacks in the heart. Okay. So P, Q, R, S, and T. So here is an isolated so-called rhythm strip ECG. ECG, by the way, is Electro-Cardio-Gram. So electrical heart kind of chart of what's going on for the heart. And there you'll see that there's the P wave, QRS and T, P, QRS, T, P, QRS, T. You can see that there's a nice regular pattern to all of these. So that's nice in terms of a normal rhythm. And then you'll see that the spacing between these is quite regular as well. And once you understand how to look at the charting of these things, you'll see that there's a number of these big boxes. If you can actually map these out and measure them, you'll have to trust me that this is a normal rate around 70 beats per minute. In contrast, what I want to show you is that there can be some circumstances where these beats are spaced farther apart. So the beats are happening less frequently. And in this example, the beats are happening at a rate of about 50 per minute. This is normal 70. This is much slower at 50 per minute. We call this bradycardia. Brady means slow, and cardia refers to the heart. So this is slow heart. It still has this normal rhythm of P, QRST, slow, P, QRST, slow, PQRST. So this is still a normal rhythm, but it's just slower in nature. And this may be because of medication effects, maybe other things. We'll talk about it in just a moment. And here is an example as another contrast where you can appreciate that these beats are much closer together. So they're going to be firing off at a rate like this, about 130 per minute. This is a much faster rate. And in Latin terms, this would be called tachy, meaning fast cardia. So PQRST, 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 PQRST. So same rhythm, but just much closer together. This is called sinus tachycardia. What do these things mean? Well, if you want to learn a little bit more about normal rhythm and arrhythmia, there is a very nice kind of watch and learn video that is available at the American Heart Association website if you wanted to do a little bit of extra homework about how these beats will work. So there's an extra resource for you. What I've distilled out in a little bit more boring form is there is the electrocardiogram, the slow beats spaced wide apart. And the reason that they might be slower are things that might be common to the group that are watching this video right now, because many of us are taking certain kinds of medications like beta blockers. Remember, beta blockers are those medicines that end in LOL, like bisoprolol, metoprolol, atenolol. Yeah, I think you've got the pattern of those lols. The way that they work is by interacting with receptors in the heart to slow it down, bring blood pressure down, bring down stress in the heart. It's a very nice thing if we are living with stressed out hearts after heart attacks, or if we're living with heart failure, much nicer to calm down the system. But one of the things that we'll notice is that the heart rate will slow down, not uncommonly. This is not a dangerous thing unto itself. It's actually quite expected from the medications, and it's a good sign that the medicines are working very well if your heartbeats are somewhere in the 50s, for instance, and if your heartbeat doesn't go up so fast when you start to exercise. We also do notice, though, that if we look at electrocardiograms in people with higher fitness, so think elite athletes, that it's not surprising to do an electrocardiogram in a healthy individual like this and find a very slow heartbeat, especially at rest. It may be 40 or 50 beats, and that's just a sign that the heart system and the vascular system are very well trained. Not dangerous at all, but it's just a little bit lower than the general population. We might also, though, think about if under circumstances we find that the heartbeat is very slow and you may not be feeling so well. Like if you told me that your energy is very low and that you're feeling cold all the time and you're feeling very slow, you're not taking any medications, then and your heartbeat looks like this, then I may worry that there might be some kind of hormonal problem, like a low and underactive thyroid. And that would be one of the medical tests that I might undertake with you if that was the situation. Low thyroid is a very kind of insidious, slow process and affects a lot of people. And an underactive thyroid, one of the clues might be a slow heartbeat like this. And then the other things we're going to worry out vis-a-vis the electrical system is that as that sinus node wears out over time, or the electrical system slows down over time, then we may develop slower heartbeats as well. So we'll just need to be mindful of that. So bradycardia could be quite normal, could be a medication effect, but it could denote some underlying difficulties as well. When is it a concern? Because we've already said that many people will have heartbeats in the 50s and it's not a problem. And some will have heartbeats in the 40s at rest. That's 40 beats per minute. We'll start to worry about this if your heartbeat is slow and if you tell us you're not feeling so good. For instance, if you're lightheaded or dizzy, especially with exertion, it may be that your heartbeat can't keep up with the activities that you're demanding of it. And then that means that it's just not got enough pep in the system. Or if you're getting tired out or actually passing out or near passing out, then those are signs, again, that the slow heartbeat is not keeping up with you. Shortness of breath may be another symptom of just an inadequate heart rate response. Chest pain or discomfort usually isn't associated with bradycardia per se, but it may be another signal that something's going awry in the heart. And then we may look for something like confusion, because the brain needs a steady blood supply with oxygen-rich blood. And if your heart can't keep up with that, then it may be contributing to some mental fogginess as well. So those are the things that you may convey to your healthcare practitioner to say, my heartbeat is slow and I'm not feeling well, so I need something else done. One of the treatments for this might be to think about the pacemaker in your heart that is kind of worn out. So if typically we'll recall that the sinoatrial node up here in the right upper part of the heart is supposed to drive the whole electrical signal. If the electrical signal is kind of wearing out, then it is possible to insert a new electrical system just externally. And in a previous session, we may have been together talking about pacemakers. A pacemaker is a device about yay big. We used to say that they're about the size of a cigarette lighter that gets inserted just underneath the skin and usually in the left upper part of the chest. It is composed of a battery and sort of a mini computer that is very good at reading electrical signals from the heart. There is a wire that is tunneled into the major blood vessel on the left, just underneath the collarbone on the left-hand side typically. And then that wire goes through to the electrical, to the heart itself. There may be one wire that's placed into the inner chamber of the ventricle. Sometimes there's another wire that is placed into the atrium. And these wires, or so-called leads of the pacemaker, detect the electrocardiogram. They read the electrocardiogram signals all the time, and then can deliver an electrical impulse if necessary under circumstances where the heart may be going too slow. This gives an example of where this pacemaker is actually driving the electrical signals to the heart. And you can see this on the electrocardiogram. This looks very unusual, right? Instead of the usual PQRST, what we now see is sharp spike, broad spike, and then reset, sharp spike, broad spike, sharp or broad reset. So these sharp spikes that are denoted with red arrows are actually the pacemaker firing off. This is not an internal beat. This is the external beat that's coming from this battery and mini computer that tells the heart to deliver its nice electrical beat and compress and push blood out. So this is how a pacemaker can overdrive the heart and take over the heart function. And then this will hopefully allow all the blood that is necessary for your functioning to keep going. That's a nice pacemaker. Okay, let's think about the other side of situations where the heart may go too fast. So this is kind of sinus beating, P wave, QRST, P wave, QRST, not much delay in between. This is going very fast at 130 beats per minute. So what are the causes for this so-called sinus tachycardia, sinus fast beats? The most obvious one that's familiar to everybody on this meeting is that exercise will make your heart go fast. You may not get up to 130 beats per minute, but it would not be uncommon for many of us to get up over 100 or so. Stressful situations, fear, anxiety, pain will make the heartbeats go faster as well, because we get release of stress hormones like adrenaline that can make our heart go fast very quickly. There are other hormones that may make the heart go fast. Remember, we talked about slow heartbeats being associated with some hormonal abnormalities like underactive thyroid. Well, the flip of that is some people that live with overactive thyroids may feel jittery, stressed out all the time, warm intolerance. I'm feeling hot and jittery all the time, and excessive thyroid hormone that's coming out of the thyroid gland in the neck may cause this situation with the heart as well. Then there may be tachycardia. Other things that may stress out the body, like low blood counts. And some of us may have gone through this experience after open heart surgery, for instance. It's not uncommon for our to lose a couple of pints of blood during the surgical process, and our blood counts may be down several points after the surgery. When the blood counts are down, we don't have as much oxygen that is delivered around our body. So our body signals to our heart, can you beat a little bit faster to push a little bit more blood to me? So anemia or low blood counts, low hemoglobin in particular, may be a signal for tachycardia. Low oxygen levels also may be a sign for the hearts to get stressed out. Fever, very common, and of course, very important during this time of infections being common in the community, may also drive our bodies to have a tachycardia. Certain kind of drugs, especially stimulant kinds of drugs, may cause our bodies to have an excessive heartbeat. And then there are innate problems with the electrical system, so-called short circuits, where we may develop propensity to rapid heartbeats. So lots of things that we need to think about when the heartbeat goes too fast. Once again, we'll have to think about, is this dangerous unto itself? Do we need to correct an underlying problem? Or is this something that we can live with? So some people with rapid heartbeats, so-called atrial or supraventricular tachycardia, fast heartbeats, many people don't feel anything at all. That there's sometimes not a very good connection between what's going on with our hearts and what we might perceive in our brains. There are some people, though, who have a very close feeling of what's going on. And the other problem that we can get into when the heart's going very fast like this, it may not be very efficient at pushing blood up to our brains in particular. And if that happens, then we may feel faint or actually pass out. Passing out or fainting is the medical term for that. It's called syncope. Syncope. We may feel lightheaded or dizzy before we actually faint. Some people are actually aware that in their chest that there is this rapid heartbeat or fluttering or palpitation. Some people, again, don't feel that at all. We may feel that their hearts are bounding, and you may feel it in your neck or in the arteries that go close to our ears, that there is this rapid bounding, especially when we have anemia, that we may feel that way. Some people may experience chest pressure or tightness or pain, again, if the demand is too high or short of breath or just tired out. If any of those things are going on and the electrocardiogram is done that shows this rapid heartbeat, then we need to search for all of those problems that we just talked about and see what we could fix, or figure out if there is something going on primarily with the heart. So one of these more challenging and also common fast irregular heartbeats that might be going on is a condition called atrial fibrillation. Again, for point of reference, this is the normal sinus rhythm, P wave QRST, P wave QRST, spaced apart very nicely. In this contrast that is shown down below, you'll see that these are skinny beats, yes, but they're coming fairly close together, so they're fast, and the spacing between them is quite irregular. For instance, these come very close. This is a little bit wider. This is even a little bit wider, but then it gets narrower, and then they're very close again. And then this baseline is actually quite wavy and irregular. You don't get this nice sense of the P wave, QRS, and T. There's just a lot of kind of irregularity to that. And it's almost like you can imagine that the baseline is just kind of quivering or shaking like that. The medical term for that is fibrillation. And this kind of skinny, fast, irregular beat is called atrial fibrillation. For folks in cardiac rehabilitation, 5 to 10% of us participating may be experiencing this arrhythmia that is called atrial fibrillation. What is going on underneath in the heart? So normally atrial fibrillation, or normally again, the heart signals start up here in one single spot in the sinus node, and then the electrical signal is transmitted down these electrical cables. So there's very nice coordination of upper chamber, lower chamber, upper chamber, lower chamber, nice regular kinds of rhythm. In the setting of atrial fibrillation, there is random electrical activity that comes from potentially a number of places. The most common ones are up in this left atrium up here. And normally, this is not the place where electrical signals may start. But if they start to fire up randomly and fast, then they can compete and start to fire down many signals down the electrical system, and then it starts to become chaotic, it becomes fast and irregular, and this is what atrial fibrillation is. Do you like my hand motions? This keeps it exciting for me as we go through these things. So that's atrial fibrillation. So there is that electrocardiogram signal that gives us this fast, skinny, irregular heartbeat called atrial fibrillation. So why might this come on? Well, all of those problems that we talked about that may cause fast rhythms in general may also be implicated in atrial fibrillation once again. There's a couple of other things that, in addition to all of these things that we just talked about, long-standing problems that stress out the heart and make it stretch. Like if you think about high blood pressure loads over many years can cause that atrium to stretch and become abnormal. In addition, some actually anatomical problems with certain parts of the heart where these electrical little centers may be, then those may be primary problems with the electrical system. So there's a number of things that we would think about with atrial fibrillation. Why is it problematic? Well, some people who have atrial fibrillation may have no symptoms whatsoever, but others will be aware that the heart is going fast and irregularly. You may feel dizzy and sweaty. You may get short of breath or feel anxious if atrial fibrillation comes on all of a sudden out of the blue. And it happens that way for some people, lasts minutes to hours and then goes away again. It tends to make you feel tired out because nobody likes to have this fast, irregular rhythm. That's not an efficient way for the heart to work. And it may also cause people to pass out. But there are some other unique problems with atrial fibrillation in particular. One of the things that we worry about is that if that upper chamber of the heart, especially the left atrium, starts to shake and quiver, the blood may not get ejected, usually out from the left atrium. And under usual circumstances, when that blood is moving, it tends not to pool. But when it's fibrillating and not doing very much, so imagine just a very fine fibrillation, the blood can actually start to pool in certain parts of the heart. And when blood doesn't move, it can start to stick and form little tiny clots. If those clots break off and travel from the heart up the neck and into the brain, well, that's a problem because then now I've interrupted the blood flow up in my head, and that's what's called a stroke. So some of you who are living with atrial fibrillation may have had that conversation with your doctors about why atrial fibrillation is a problem, the complication being stroke, and why we might actually need to take some blood thinners to prevent the clots from forming inside of our heart if we're living with atrial fibrillation so that we don't experience this stroke. Other people, if the quivering goes on for a long period of time, days, weeks, months, at a very rapid rate, well, our hearts are going to get tired out and we may develop heart failure or just feel tired out all the time, or our rhythms may even get worse than they are, or we just won't have an adequate blood supply throughout the heart. So this is not a happy situation for us. So we may want to actually manage the atrial fibrillation wherever we can. And the approaches may involve some of the following. So we are actually aware already of certain medications that can slow down the heartbeat. You know, the beta blockers, the LOL drugs will kind of slow things down. They may not change the irregularity, but if you can slow it down, then the heart will be able to catch up to some degree, push more blood out and help you feel better. There are medications that are anti, so that they're against the bad rhythms, anti-arrhythmic drugs that may help the heart rate to return to normal and maybe even the irregularity to get back to normal. And there are various forms of these. Some are quite strong, and it's a matter of finding the balance between the effects on your heart and the effects on your body, but you and your doctor and healthcare practitioner will find the right approach. We talk about blood thinners to help keep blood clots from forming. And then we may need to do for some people, do something a little bit more definitive, such as electrically shocking the heart back to normal. And sometimes that reset can work one time. Some people may need to go back for a couple of these electrical cardioversions or electrical shocks. And in other people, we may actually try to do some kind of surgical procedure or ablation procedure to get back to normal rhythm. And here, I'll show you a little bit about what might be going on and what can be done. So once again, in the normal heart signal, sinus node drives the electrical signal down to the AV node and down to the electrical cables. In atrial fibrillation, there may be multiple sites for the impulses to go on. The way you might figure out where the abnormal signals might be arising is to do an electrical mapping procedure. And here we're showing you that at the time of a catheter study of the heart, we might go into the major blood vessels in the groin, like for at times of angiography, or looking at other major blood vessels in the heart. Here, we're trying to get a catheter up the venous system into the left atrium, across to the right, into the right atrium, across to the left atrium, and then with this catheter to do some mapping of the heart. Here's a more detailed diagram that shows a catheter that will actually map electrical signals. And here there is a wire that has a ability to deliver either radio frequencies or cold kind of freezing energy to different sections of the heart. So if you find, for instance, that here, this spot was the place where abnormal electrical activity was coming up that triggered the atrial fibrillation, it is possible in this lower cartoon here to deliver a source of energy around this area that is quite abnormal and then get rid of it or cause ablation. Just get rid of that source for abnormal electrical activity, and then hopefully restore the usual sequence of electricity, because the usual normal pathways are still intact. But in this cartoon here, you'll see that there's multiple sites that the operator is trying to get rid of. Okay, that's all the atrial stuff. And then just a couple of words about ventricular problems, and then we will end here. That once again, for orientation, here is the normal electrical activity. P wave QRST, P wave QRST, spaced nicely apart, nice and regular. This is the upper panel here is called normal sinus rhythm. You're very good and familiar with that now. Here in the lower part, we're showing you there's a P QRST, but then this very wide, bizarre looking beat, followed by a long pause, P QRST, wide, bizarre signal, longer gap, PQRST, wide beat. So this kind of very strange looking beat here arises from the ventricle. It's coming in earlier than it should be, and it is a unusual looking beat. So then we would denote this as one that arises from the lower part of the heart, the ventricle, coming in early, ventricular premature beat. And those are the kind of the waveforms that we'll look for on the electrocardiogram. So why are these important? When you get single ones of these, usually not a big deal. Many people have them, doesn't really cause problems. Some people are aware that, oh, I think my heart just skipped a beat, so to speak. Well, it doesn't really skip. What usually happens is that you just get an early one that you may not be able to feel with your pulse at the neck or in the wrist, or if you're actually feeling your chest, you may not be able to feel them, but electrically, there's still usually something going on. When this becomes a problem is if you start to put a whole bunch of these unusual irregular beats together. And that's what this thing shown here is. So big warning symbol. This is normal rhythm. This is what you can obviously see is very fast, very wide, very unusual kind of thing. It almost looks like the teeth of a shark or something like that. There's something to think about. That's dangerous. This is wide shape, so that tells me that this is probably coming from the lower part of the heart, the ventricle. Beats don't belong from that site, and they're going very fast. So this is a danger sign for me. I don't like this, and one can get into a lot of trouble, especially if this carries on for more than 10 or 20 or 30 seconds. This is trouble that's waiting to happen. The reason that this might happen is that there are often problems underlying the heart's electrical system or something going on that's causing the heart to get into stress and in trouble. For instance, if there is a blockage of coronary artery blood flow depriving oxygen to the heart tissue, then it can signal you by saying, I'm in a lot of stress here. This is giving me a lot of trouble. And for some people that might have been through a heart attack event, for instance, where there's actually complete blockage of blood flow, the heart muscle can signal, I'm going to deliver this very scary heart rhythm here called ventricular tachycardia. And this is the thing that may actually lead to the heart stopping, so-called cardiac arrest. Other people, if there's already been damage to the heart muscle, either because of a heart attack or some other issue that's caused distortion of the heart muscle, well, again, once again, those electrical cells in the heart may get stretched, distorted, and they may be prone to sending off these electrical signals at times. There are certain kinds of medications that may surprise us that may trigger this kind of ventricular rhythm. And this is why we need to be really concerned about all the pills that we take when we're living with heart conditions, or even when we're not living with heart conditions. In the past, there were certain kinds of antihistamines or antibiotics or antifungal drugs that may cause abnormalities in the electrical system that make it more likely to have these kinds of ventricular tachycardia. In the time of COVID, one of the real concerns was this kind of brief period of time where folks were getting excited about unproven therapies like hydroxychloroquine and antibiotics taken together as a mixture to try to prevent or treat COVID. Well, one of the side effects of that was actually rhythms like this that happened in a few vulnerable people. So never take medicines without consulting closely with your healthcare practitioner. And I would say, especially with your pharmacist, to tell them, look, I've got heart issues. Are these medicines safe for me? Because some of the dangerous side effects could be like this. Similarly, I know I laugh nervously saying, before you start to use illicit drugs, which I hope you never use, of course, there are the reason that why certain illicit drugs like cocaine can be very dangerous to the heart is they could trigger dangerous rhythms like this. And then finally, the reason that we want to pay really close attention to your blood chemistry, especially potassium levels, we don't want potassium levels to go too low or too high. Close regulation of potassium is critical for normal electrical functioning of the heart. When it goes abnormal, you can develop crazy rhythms like this that can be life-threatening in nature. If one experiences ventricular tachycardia, once again, the symptoms may not be all that specific, but again, your heart may tell your brain things are not going very well, and the brain may sense that it's getting dizzy. It may sense that there's irregularity in some of the heartbeats. You may feel short of breath. Nausea is an interesting one that gets triggered when the heartbeats come along. Sweating, I should have put on there as well. I've met some people that know that their heartbeats go off if all of a sudden they get sweaty and feeling on like their stomach is upset. Lightheadedness, falling unconscious is the thing that makes us worry greatly about people living with heart conditions, that we're worried that an irregular heartbeat may have occurred. And we talked about cardiac arrest in extreme cases. Ventricular tachycardia is a worrisome problem. Sometimes we'll leave it alone, but most often we're going to approach this with medications. And once again, we get to medicines that just may better regulate the heartbeats, like the beta blocker drugs. We may use ablation procedures like we talked about with atrial fibrillation. If we can find a source, then we may burn or freeze it using those special catheters with radio frequency ablation or freezing approaches. Surgery may sometimes be needed. Defibrillation will be the thing we do in emergency situations. And we also may think of defibrillation, shocking, in situations where there's a longer term risk of this going on. So this cartoon reminds us that there are pacemakers, but there's also fancier pacemakers called implantable cardioverter defibrillators. So think of the pacemaker battery mini computer that might be here with the electrical wires or leads that go to parts of the heart like the upper atrium and the lower ventricle. In this case, the wires are going to read ECG signal all the time and then feed that back immediately to the implantable cardioverter defibrillator. If the defibrillator senses, gosh, this heartbeat has really gone terribly, and there's ventricular tachycardia, or in this case, ventricular fibrillation, warning signs go off inside the computer saying, okay, I'm seeing this going on. 1 second has passed, 2 seconds have passed, 3 seconds have passed, 4 seconds have passed, have gone with this, and nothing has happened internally in the heart. What I'm going to do with my computer smart algorithm is I'm going to deliver a strong shock to the heart to cause a reset. So this is the defibrillator part of this implantable cardioverter defibrillator. So now it's been able to shock the heartbeat back to regular rhythm. Now you see the thing that you're very familiar with, P wave, QRS, T, P wave, QRS, T. So now it's been able to restore normal sinus rhythm with this defibrillator. So that is modern technology, and some people, or actually tens of thousands of people in Canada today, are walking around with these defibrillators in their chest that will keep them out of trouble. If you want more about this session, about arrhythmias, then I'd invite you to look at the American Heart Association website for videos and further description about rhythms. And of course, we would highlight the resources that are available within our own Cardiac College platform and look to the chapter booklet about how your heart works and the common types of heart problems. Wow, that was a very involved session for us today. Maybe you have some questions that you'd like to pose in the Q&A. I don't see anything that's come through in this very long session that I've delivered so far. I'll give you a bit of time to pose any of those questions that you might have, but I can certainly understand that this may have been satisfactory to the things that might have been on your mind. Okay, I don't see anything there, but of course, if any questions do arise after the fact, you'd certainly be welcome to pose them through your cardiac rehab case manager. I see that someone has a hand raised, but I wonder if you might actually type something into the Q&A instead. And I'm giving you just a moment to get there, and here we go. Okay, I've got half of a question about low heart rates and then a blockage. After bypass has happened. So let me try to piece together what a question could be. It's like a little bit of a game of Jeopardy. So some people are living with heart rates that are low all the time. And then we said that might be your natural state. Some people are living with low heart rates after having had a heart attack or some kind of procedure like an angioplasty or a surgery. And that may be a consequence of being put on medications like the beta blocker medications, the ones that end in LOL. So those medicines are being offered to you, again, to reduce stress in the system. And one of the ways that does that is by lowering heart rates. At some point, you and your healthcare provider may decide that it's time to come off the beta blocker. Typically that's a year or so after having had a heart attack or surgery. Some people may come off of those medicines. Some stay on longer. But if that's the situation, if the medicines are removed, then your heart rates may start to come back up again by 10 beats or 20 beats at rest. And all of that is quite fine as long as you are feeling that way. So 2 scenarios. Your heart rates might be low naturally and they may stay low that way. Other people, if your heart rates are low because you've been put on medications after an event or surgery, if the medicine stays on, your heart rates will stay low. If the medicines are removed, the heart rates may go up a bit. And all of those scenarios are quite fine as long as you are feeling fine in that way. Okay. Another question related to the beta blockers about slow heartbeats is that you may have been put on a beta blocker medicine, such as bisoprolol 2.5 milligrams. Would that be the reason why it's difficult for heart rate to go up with exercise? And yes, that could very well be the reason. We see this very commonly, that instead of like starting off at a heartbeat of 70 and then going to 130 under circumstances without medicines, with beta blockers, your heart rate may be 60 and only go up to 100. Irrespective of those scenarios, it is still very likely that you'll get an excellent workout. Your cardiac rehab case manager will work with the situation that you have and the medicines that you have to design the right kind of exercise program so that you will get a very good level of workout with the medicines on board. Okay. Another question is, what can be done to prevent an atrial fibrillation episode? And a great question that we can kind of look at the possible scenarios. And some people have only one single atrial fibrillation episode and then never another, and you don't need to do anything. Some people have these episodes coming back over and over again. If it's more of a frequent returning thing, this is where the doctors may offer up some preventative therapies like medications like the beta blockers or another related medication that may regulate the heart rhythm. And this may reduce the frequency of atrial fibrillation coming on. For other people, some people may just go on to blood thinners if the atrial fibrillation comes on very frequently, and then kind of leave the heart alone. So there's a number of different scenarios that one may go through. The other thing to reduce the risk of another atrial fibrillation episode is just to make sure that there isn't anything underlying it that may make it more likely. We talked about the anemia or the thyroid issue, or other medications that may trigger atrial fibrillation. So hopefully that's been looked at with your situation. And then maybe just one variation on the original beta blocker question and heart rate question is that some people may have a normally or a low heartbeat under usual conditions, go on to medicines and find that the heart rates are even lower, and that may necessitate removal of that beta blocker medicine. And so that could be a scenario. Even after the beta blockers are removed, there are some people that may still have very slow heartbeats, and then it's a matter of figuring out, does that need further investigation or remedy? And again, it depends on the heartbeat itself, the rate itself, and the symptoms that are associated with it. So some people have heart rates in the 40s, and they just may be left alone with those heartbeats as long as you don't have weakness, dizziness, shortness of breath, chest pain when you're up and going. Other people, if you've got some of those symptoms and your heartbeats are slow, then that is when you might have a further investigation with a longer term electrical tape recording of your heartbeats, something called a Holter monitor. If they find that it's going very slow, or if there are pauses in the heartbeats, that's when discussions may be had about putting in something like a pacemaker as a backup system. So for those of you who may be experiencing that kind of scenario, I'm sure you'll discuss it with your heart specialist about, is there anything further I need to have done vis-a-vis medicines or investigations or other kinds of treatments? Great. I'm delighted that some of you have asked questions, and hopefully these responses have been adequate for you. Again, if anything comes up afterwards, please flag the questions to your cardiac rehab case manager, and they can pass them on to me, and we can have a further dialogue about them. Okay, well, that brings us to an end with today's session. We'll remind you that Healthy University is now on social media, so please follow us on Twitter, and please follow the Twitter handle healtheu_TRI, and there's the web kind of address for our Twitter platform as well. And we hope you will join us again next week. I'll be back with you talking about heart medicines, and we talked a little bit about it today, and we'll talk about it further next week. Thanks very much for joining, and wishing you a great day. Take care.